Well, hello everyone. I'm Russell Ray with Oklahoma Career Tech, and welcome to Career Tech Conversations. On this podcast, we discuss the many ways Career Tech is breaking down silos in education and giving students of all ages the skills they need to enter the workforce and make informed career choices. Our focus today is on healthcare, and here today to guide us through this discussion is the State Program Manager for Health Careers Education at Oklahoma Career Tech, Lara Morris. Lara, thank you so much for taking the time today.
Thanks so much for having me. I'm honored to be here.
Well, Lara, you have been the State Program Manager for HCE, Health Careers Education, since 2001, for 21 years now. You've seen a lot of changes over the year. Can you tell us a little bit about how the HCE program at Career Tech has evolved and changed over the years? I assume you've seen a lot of changes in that time.
I think so. There's although a lot stays the same, a lot changes as well. So we've had adult programs in areas like respiratory, radiologic technology, and so on for many, many years. But we've also done some really exciting things. We have a partnership with OU to offer our dental hygiene program at 3 of our rural campuses, and that's something that was kind of cutting edge at the time we did it.
Really?
We also have one thing that's changed probably the most is my background's athletic training. I'm of the mind that not everyone in the world wants to be a nurse. And so one of the things that we did is we adapted our core curriculum to where it was not just nurse aid focused. And we offer many, many different options for entry-level students instead of just certified nurse aid. And that's something that was very different. That never happened before. And we have a lot of teachers now that come from all different kinds of health careers, not just nursing. So,
I see. I see. Athletic training. So that's a bit different, kind of a departure. Is that program still thriving today?
Oh, well, we have a few programs that teach athletic training, or actually student athletic training for high school students. Those people with a little more therapeutic bent, they would rather be in the rehab specialties. They want to be a physical therapist and so on. So we tried to offer things that would be a little more interesting to different populations, vet assisting, dental assisting, and so on. It used to be pretty straight. Everyone did nurse aid if you were going to come to Career Tech. So.
Well, as everyone knows, Oklahoma continues to face a nursing shortage here in the state. Is it safe to say that healthcare education and training has really never been more important because of that? What kind of jobs you think are needed the most in the healthcare industry?
Well, if you talk to any healthcare professional, they're going to say whatever it is I do. So everyone knows we have a nursing shortage, and that's been brought to the forefront. I actually did a little research to see what in the state of Oklahoma, what we were low on. And there's some positions like occupational therapy. There's physician's assistants, all of the specialty physicians. So if someone has an interest in becoming a physician, finding someone who wants to focus in pediatrics or emergency or a specific area, that's a little more difficult. Nurse anesthetist, I never can say that word, but look at me challenging myself on a podcast saying that. So, and of course, I'm going to say certified athletic trainers. One of our goals has always been having an athletic trainer in every high school to help students that may have athletic injuries.
So the need is pretty much every category.
Diverse.
I see.
It's all across the board. Yes.
I see.
So we do have great enrollment in our programs for the most part. A lot of students may not know about all the different health careers that are out there, though. So.
I see. Back in June, the Oklahoma legislature appropriated $8.8 million of funding from the American Rescue Plan Act, ARPA, to expand career tech programs to help mitigate the shortage of nurses here in the state. Can you tell us a little bit about those ARPA funds? How are they going to be used, and where are those funds going to go?
Well, we have about 8 to 10 technology centers that submitted very specific proposals for what they wanted to do with that funding. It can be anything from I'm going to create a simulation laboratory to adding faculty, perhaps being able to add more students in. If you want to add more students, you have to add a faculty person. For every 10 to 12 students you add a faculty person. So that kind of, there's a lot of things that they could choose from, and everyone did it specific to their own needs. We have the funds going everywhere from Autry and High Plains out in northwestern Oklahoma. There's also Tulsa Tech, Great Plains down in southwestern Oklahoma. So we have people, and Northeastern Technology Centers also was a recipient. So we really have the money going statewide. That's great.
That's great. We talked a little bit about the nursing shortage already. How would you describe the nursing shortage here in Oklahoma? Is it a critical situation? Is the gap closing? How exactly would you describe the level of that problem?
Well, one of the most difficult things that we face is having accurate data that's in time. That's current right now today. I know that we have across the board, hospitals are reporting openings that are just above any that they've seen in a long, long time. I have been part of this for 21 years, and about 18 years ago, we worked to put together the Oklahoma Healthcare Workforce Center, and it was actually legislated, and funds. But funds were never put to it, so we never had an opportunity for data collection and dissemination like we had hoped for. I say this to say we have some information. The nursing shortage is real. We've known about it for years that it was coming, but I think COVID exacerbated the need for nurses. We've had a mass exodus, especially in bedside nursing. Yeah. So those would be people who provide not necessarily administration, but the people who provide care every single day to patients. In Oklahoma, we're a little unique. We do have a very large number of licensed practical nurses, and that's one of the main areas that CareerTech trains for is licensed practical nurse. Rural areas utilize LPNs as bedside nurses quite frequently, whereas some of the larger, more the hospitals in metropolitan areas may not utilize those professionals as much as registered nurses. So it just depends on where you're at, I would say, how bad it is, but it's definitely not good. You do not want to get sick right now if you can avoid it.
Well, you mentioned the situation with our nursing shortage was exacerbated by the pandemic. Right. CareerTech is known for its agility, its flexibility. Where we were talking off air a while ago about the nurse refresher program and some changes that we made to that program. Can you talk a little bit about the nurse refresher program and what we did to entice people to get back into the profession?
Sure. So about a year ago, we worked with higher ed. We worked with OU College of Nursing, and we decided to do everything we could to streamline the process. There has been a process in place for nurses to be able to reinstate their license, or if they've never taken the test, go ahead and take the test.
I see.
So this would be the training that would be required before they could do those things. So what we did is we moved everything to a competency-based education. So the course is now you take a test over safety, let's say, and then if you pass the test, you don't have to go through that content. And then they can progress to the very next module. And so all of that curriculum is online. Again, it's for both LPNs and RNs.
Yeah.
And then once they finish that, we also adapted what we do at the CareerTech part is that we do the clinical experience, and we made the clinical experience where optionally they could do it all online. And that,
I see.
Yeah, and that saved people having to get specific uniforms, have the shots for that facility, do the employee training that they would have to do. And then we were so lucky that we had a wonderful foundation that gave $200,000, and so we got the price of the training down as well, where that trained 100 people to be to get their licenses reinstated. So we felt like that was a huge. We still get calls every day.
Really?
People saying, I heard you had money to do this. And oh, that money's gone for a long time. But so if anyone out there wants to partner with us to be able to get more nurses back out quickly, we'd be happy to tell them how it worked before.
We were seeing a huge need in the need of nurses during the pandemic, and CareerTech responded by, as you said, we streamlined the process for people to get back into the profession or enter the profession to begin with. Very good. In a related question, on a per capita basis, Oklahoma ranks 46th in the country with about 700 nurses per 100,000 population. That's well below the national average of 1,100 nurses per 100,000. Why is Oklahoma's ranking so low? Is it because of competition in other states? Do we need to be raising salaries for nurses? All of the above?
All of the above is always a good answer. Always pick D. All of the above.
There you go.
Yeah, and when in doubt, pick D. Yes, we do need more programs. We need more training. With that, I'd love for people to understand that it's not as easy as just opening a program or adding more students onto your roster. You also have to have qualified faculty. You have to have a qualified director. If the program goes through national accreditation, there's many things to consider there. Clinical sites are difficult. Many of the people who go into education choose education because it has a more stable schedule. They don't have to work that 7-8 hour shift in the middle of the night, and a lot of people have left nursing because it's a 24/7 occupation.
It's very stressful.
Very stressful, very hard. And I would say too, in Oklahoma, we've gotten in to where we many times have filled the gap with traveling personnel.
Oh, really?
And and many times hospitals, just from people I know personally, a gap will be filled with someone who's making 3 times as much money as the person sitting next to them that's been a career employee for that particular facility. Yes. And so there's a lot of things that kind of chip away at morale, I guess you would say. And the pandemic certainly didn't help with that at all. So there's just I think there's a lot of reasons why people are leaving. I do think we do a great job in CareerTech of training a lot of licensed practical nurses. This is a great stepping stone into other levels of nursing. From there, you can very quickly get, within a year or so, about a year and a half, get your associate degree in nursing and sit for the RN exam. So we have a great career ladder, and I do think we have a lot of people that take advantage of that. However, when it comes down to it, in rural areas, it's hard to get qualified people. And so many times our licensed practical nurses fill gaps that might not be done in other states that might not have the rural areas we do.
You touched on this a little bit already, but we talked a little bit about why nurses and healthcare professionals are leaving. But a lot of healthcare professionals are staying. What is so rewarding? Can you talk about some of the rewards of a career as a nurse or in another profession in the healthcare industry?
Sure. One of the things that there's so much variety. Every day is different.
Yeah.
And I think that's probably one thing. I know me personally, that was something I loved about my first career, was that every day there was a new challenge, something new to think about, a different way to try and problem solve. I know that, so it definitely, healthcare professions will always be there. So that's nice. Yeah. You don't have to worry about that job field drying up and going away because we need everyone.
That job security.
Job security, right. Good salaries. I mean,
really?
We talk about that, yes, we need more, but but when you look at what it can do to a family just to have someone become an LPN and what that return on investment is back to the community, to have citizens with a skill that can go to work in a healthcare profession, then, I mean, there's some things that are, I would say, invaluable too, that we can't really put a price tag on. But there's, and then almost everyone gets into healthcare because they want to help people.
Right.
Yeah,
right.
That's what you hear until people get annoying. And then when they're tired of taking care of them, which, everyone's had someone in their family that's sick. And, I'm sure it is hard. I mean, it's not always easy because people don't feel good usually when you're working with them, or they're hurt, or they need something from the healthcare professional. And I think it's that there's a big challenge to that.
As you said, you really can't put a price tag on a rewarding, fulfilling career like that, but let's try to put a price tag on it. Can you talk a little bit about the range of salaries, the entry level, and so on and so forth? What's the range of salaries somebody can expect?
I would say we're probably our low end right now. Long-term care nurse aides are still probably the lowest, and many of them make minimum wage. $10, maybe $12 an hour would be a pretty good salary. Most of the positions that we train for that require an associate degree are getting closer to between 15 and 20. Then when you go into very specific things like, let's say a rad tech, or someone who does diagnostic medical sonography, an ultrasound tech, they're in the 60s when they start out. Yeah. So there's some professions that do very, very well. Depending on what you want to do and where you want to work, that differentiates a lot. I think we're closer to probably around nurses are probably making on average about $25 an hour now.
Really?
And that would be across rural and metropolitan areas. So it's creeping up, but it's still probably not where they would wish it was. Yeah.
Well, being a nurse, having a job in the healthcare profession probably isn't for everyone, obviously. But what kind of student, what kind of person do you think would be well suited for a career in healthcare?
Well, a lot of the flexibility, someone who enjoys maybe doing different tasks every day. Someone who likes to learn, because you have to be a lifelong learner in order to be successful in healthcare. There's always something changing, a new test, a new protocol. When I started, this is how old I am, but when I started, we didn't wear gloves. I mean, I know, right? That tells you just how old I am. It wasn't until the early 90s when HIV became prevalent, and we realized that it was transmitted through blood products. And so there was a whole lot of wounds that I used to take care of with football players, scrubbing on a wound or something, and never ever wore gloves. And so tell me,
things have changed.
Things have changed a lot. And there was a few years right after, when all that was going on, that I was like, wow, that was kind of scary. Why have we not been wearing gloves all along? I mean, it's kind of crazy. But anyway, just having a lot of different opportunities available. There is in almost every profession some type of ladder.
Yeah.
You can be trained, you can get a specialization, you can get an additional certification. So there's a lot of opportunities in healthcare as well. Students who like math and science, that's always a great, I'm going to say math, but that's never been my forte.
Not me.
Now, science is okay. I get that. But anyway, there's a lot of people who, my husband will laugh when he hears this, but compassion probably helps. He says, I don't have any.
That's a great point. He says you don't have any.
He says, I don't have any because, when he gets sick, I'm not very compassionate, but you'll be fine. You'll be fine. So anyway, there's a lot of different, I guess, features or different qualities that would make a good healthcare professional.
So I'm sure we have a lot of students and adults out there listening right now, and they may have a proclivity to math and science and are wondering about the best way to start their path. How would you advise someone on doing that?
Well, years ago, they put us through ASVAB. Did you ever take the ASVAB test?
No.
No? Okay. Well, the military had this test, and it was to tell everyone what you would be good at. Okay. So this is
my whole life may be different.
I know,
had
right?
I done that.
Just if you had the ASVAB. Anyway, so
is it too late for me?
I don't know. Sign me up too. But we even have here at CareerTech, we have a wonderful product called OK Career Guide, and anyone can utilize that product. You can go out, create an account. You can take a number of different assessments, short assessments that will kind of guide you to, hey, you might be great at healthcare, or I see you in a communication occupation, or whatever it may be. So there's other things out there. Of course, you can always go online. Another great product that I personally know about is from a company called U-Science, and they do also something that is, they have different levels of assessments, but one of their main ones is aptitude. So what are you likely to be successful in? Yeah. And I think that's really what everyone wants to know is what would I be good at? And listen to your family and friends. They'll tell you what you're good at too. I mean, you may not like what they say, but they'll tell you what you should be doing. So that's a great way to get started.
One of the great things about CareerTech, I think, is the curriculums are really based on partnerships with business and industry. They have input on what that curriculum should look like. Are partnerships pretty critical in developing training programs for nurses and other healthcare professions? Can you describe some of those partnerships for us?
Sure. We just on a day-to-day basis, we utilize national standards. And so specifically, we just met with the RadTech instructors last week to go through their curriculum and identify common courses, hours, objectives, all of those things. And so we used Association of Radiologic Technology, their curriculum, basically their plan as our plan. So many times we utilize professional associations, and people are active in their professional development communities. And so that's one opportunity. Another one thing that we constantly work with the Oklahoma Hospital Association. I have an excellent person I work with at the Regents for higher education. We're always looking for ways that we can partner together to make the roads smoother for students, and eventually for our end goal, which is the business and industry partners who need our product. So,
well, reliable healthcare, that's a big issue here in this state. CareerTech is a big part of that. You're a big part of coming up with the solutions for that. We really do appreciate everything you've done in the healthcare industry, and we look forward to seeing the results of all your hard work. Laura, thank you so much for being with us today. I really do appreciate it.
Thank you.
You bet. I've learned a lot. I hope our listeners have learned a lot as well. For more information about healthcare careers and other CareerTech programs, you can visit the Oklahoma CareerTech website at okcareertech.org. And don't forget to follow CareerTech on social media. You can find us on Facebook, Twitter, LinkedIn, and Instagram. Thanks so much, everyone, for tuning in. We hope you join us for our next episode of CareerTech Conversations. For Oklahoma CareerTech, I'm Russell Ray.